Hello, this is Nupe People, Places and Things. My name is Salome Wusa Saba and I will be discussing an important topic which I believe most of you have heard of but may not know in detail. Please relax, enjoy and learn. The topic I will be discussing is hypertension. Now, this medical condition has left many on the wheelchair while some has unfortunately passed away. What is hypertension? Hypertension is also known as high blood pressure. Now, it is a medical condition where the pressure in the blood vessel is consistently too high. This means the force of the blood pushing against the wall of the arteries is higher than it should be. Now, imagine the blood vessels like pipes. When the pressure inside those pipes becomes too high, for a very long time, that's hypertension. This high pressure can damage the pipes over time and increase the risk of other health problems. When there is a broken pipe that transports water to various homes, this water becomes vulnerable to germs and odor, as anything, animals, insects, and even humans can deposit dangerous organisms into this water. This can cause several health problems to the consumers of this water. Now, this is a typical example of how high blood pressure operates. Now, hypertension poses a significant health burden globally. In Nigeria, hypertension prevalence is on the rise, with low rates of awareness, treatment, and control. Hypertension is a significant public health concern in Nigeria, with prevalence rates ranging from 20% to 40% in some studies. While awareness of hypertension has increased, treatment and control rates remain low. Several initiatives are underway to improve hypertension management in the country, including the National Hypertension Control Initiative (NHCP) and the Hypertension Treatment in Nigeria (HTN). According to World Health Organization, an estimated 1.28 billion adults aged 30 to 79 years worldwide have hypertension, most living in low and middle-income countries. An estimated 46% of adults with hypertension are unaware that they have this condition. Less than half of adults with hypertension are diagnosed and treated. Approximately 1 in 5 adults with hypertension have it under control. Hypertension is a major cause of premature death worldwide, and that is why we must create awareness and practice a healthy lifestyle. One of the global targets for non-communicable disease is to reduce the prevalence of hypertension by 33% between 2010 and 2030. This is from the World Health Organization. Hypertension in Nigeria can be caused by a combination of factors, including lifestyle choices, genetics, and underlying health conditions. Common risk factors include obesity, physical inactivity, unhealthy diet, that is, high intake of salt and saturated fats and processed food, smoking, which constricts the blood vessel, increasing blood pressure and the risk of cardiovascular disease, and excessive alcohol intake. When you drink too much alcohol, it can raise the blood pressure and increase the risk of hypertension. Additionally, family history or hereditary, age, and stress can also increase the risk of developing hypertension. Certain conditions like kidney disease can cause secondary hypertension. Now let's talk about the symptoms of hypertension. How do we know if someone is hypertensive? How will you know that you are hypertensive? Now, hypertension or high blood pressure often has no noticeable symptoms in Nigeria, which makes it a silent killer. However, some individuals may experience the following symptoms, which include headaches, nausea, vomiting, dizziness, blurred vision, nosebleeds, heart palpitations, breathlessness. Now, when blood pressure reaches dangerously high levels like 180/120 mmHg, it can lead to a hypertensive crisis, which is a medical emergency. In such cases, symptoms may include severe headaches, severe dizziness, difficulty in breathing, and potential damage to the heart, brain, kidney, and eyes. If you are experiencing any or all of these symptoms, please visit the healthcare provider for checkups and preventive measures. It is often said that prevention is better than cure. What are the preventive measures for hypertension? How do we prevent hypertension? First, you must live a healthy lifestyle, reduce your intake of salt and alcohol, quit smoking, involve yourself in exercise, manage stress, and do a frequent hypertension checkup to monitor your blood pressure and seek medical attention when needed. Now let's talk about the treatment of hypertension. As I have said earlier, you must have to change your lifestyle, that is, engage in regular exercise, eat balanced diet, manage your weight, reduce stress. If you're too tired to do anything, please rest. Reduce or quit smoking and intake of alcohol. Secondly, there are certain medications that can help in treatment of hypertension. Drugs like diuretics, beta blockers, ACE inhibitors, calcium channel blockers, and many other medications. If you notice your high blood pressure has become higher than normal, please seek medical attention, because if left uncontrolled, hypertension can lead to severe health consequences. In conclusion, the Nigerian government, in collaboration with the World Health Organization, has launched initiatives to curb hypertension, such as the National Hypertension Control Initiative (NHCP). This program aims to strengthen the hypertension management at the primary health care level and improve awareness, treatment, and control of hypertension. There is the need for continued effort to address hypertension in Nigeria through increased awareness, improved healthcare access, and effective management strategies. I hope this awareness is an eye-opener on the effects of hypertension. Please share this message to your loved ones so we can reduce the rate of mortality due to hypertension. If you notice persistence of any of these symptoms, please seek immediate medical attention. Stay safe and stay healthy. Goodbye.
Hey, Bawelo, Bawelo, yeah, Bawelo. Can't one know, can't one know, can't one know, can't one know.
Mijabo, 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 Mijabo.
Kube legend, Kube igiri, Kube lozun. Kube legend, Kube igiri, Kube lozun. Bawelo. Can't one know, can't one know, can't one know, can't one know.
Mijabo, 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 Mijabo.
Kube legend, Kube igiri, Kube lozun. Kube legend, Kube igiri, Kube lozun. Bawelo. Kube legend, Kube igiri, Kube lozun. Kube legend, Kube igiri,
Pawelo.
Abuelo, hey. Abuelo, yeah. Abuelo, que bueno, que bueno, que bueno, que bueno.
Mijabo, 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 Mijabo.
Kube legend, kube igiri, kube lozun. Kube legend, kube igiri, kube lozun.